welcome Cameron from the Cameron Veterinary Services. We have lovely nurse assistant Lucy, and this is Henry. Today we thought we'd do a little video for you just to have a look at the process of a dental, which we should stop calling it a dental and it should be an oral health exam. And what we do here at the Cameron Veterinary Services for you. So just a bit to show you how we look at these horses, how we look at their mouths, and how we look at the whole picture in terms of weight, any bit related or riding related issues, maintaining weight, all those sorts of things, especially coming into winter. Very important, as a lot of our older horses in particular starting to lose weight, drop weight, and there can be a lot of dental conditions associated with that. This horse is a young horse, and it's a very routine examination. He was done about 12 months ago. He has had wolf teeth removed, and we're just here again 12 months later to have a look and see how he's progressing. So I'm going to go around the other side and inject him because it's habit, but we'll inject him and sedate him and go from there. Awesome, nice and loaded into our crush. Sometimes these guys require some top-up sedation as we're going along, but we just judge how the horses react. Each horse reacts differently to the sedation, so we want to make sure that we have a comfortable level of sedation, that they're not reacting, but we can also have a good look inside their mouth. So we always start off with a bit of a distance exam. So when we're looking at the horse, we want to make sure that we're looking for external signs of swelling, discharge. Do we have any discharge coming out of their nasal cavity? Are they balling up feed? Owners will help us with answering this as well. So are they dropping food while they're eating? Are they having issues with a bit on a particular direction? Or are they just in general a routine checkup? I always start off by tapping the sinuses to see if we can hear any dullness that might be consistent with a sinus infection. Is there any swellings on the external side of the face? Temporomandibular joints, up underneath the jaws, eyes, no discharge, nasal cavities, any discharge, and just keeping an eye out for any of those. Some horses will develop swellings underneath their jaw, in particular young horses, that's common, and that's associated with the eruption of the teeth, but is it in the submandibular glands or anything along those lines? Next step we want to do is we want to have a look at the incisors. So nice and sedated, we're going to lift up our lip and we're going to have an examination of the incisors. We can age horses quite accurately on our incisors up to about 5 years of age. So in this particular horse, we know that he is, as these teeth erupt, 2.5, 3.5, 4.5, in wear by 3, 4, 5. So this tooth hasn't erupted, but it is starting to erupt. So we know that he is 4.5, heading towards 5. He's got that tooth has erupted, that tooth hasn't. So he's in the middle of that sort of 4.5 age mark. He's got a few little grass seeds packing in there. They're not too bad. He did have, and I noticed this in the paddock, he had a remnant of a tooth on this side, which has come off, left a little ulcer, which is what's packing with some grass seeds. And there's the adult tooth erupting underneath it. It's all relatively normal. We just keep an eye on it as it's tracking to see if there's going to be any problems associated with it. We will also have a palpate of the bars of the mandible to see if there's any problems associated with that. Sometimes you'll get pain. Want to make sure that we have a normal rostrocaudal motion. So is there an overbite? So we always look at these teeth from the side on, and we don't have anything. And then a little bit of contact in his jaw. Cool. All right, so we're getting our speculum on so that we can have a good look inside that mouth. We always have a halter on to help our backs and hold the horse's head up. And we want to make sure, first thing we do is we clean the mouth out. If we can't see it, we can't diagnose anything. So we want to get rid of all that food particles that's inside the horse's mouth and make sure that we can actually see the teeth that we want to see. So nice gentle stream of water just to hose out that remnant food that might be packing inside his mouth. Sometimes in really bad cases as well, you'll see a horse, you'll get a big wad of food will drop out now. And that'll often be if they're packing food around. You spray your nurse with the water just to keep everyone awake. And this is sometimes too where you'll get a bit of smell, you might get a bit of discharge, you might start to notice some periodontal disease has a very distinctive smell. So we're sort of paying attention to all of that as we're going along, just to make sure that we're not going to miss anything. Sometimes it takes several flushes to get all this food out too. So just give him a good little hose out. And we might have to do that again, but we'll just have a little look-see. Key to any good oral exam is a light. We can't, again, diagnose anything if we can't see what we're looking at. We're not here just to rasp teeth. We also want to make sure we can diagnose any dental conditions. So we want to have a nice strong light. And you'll see my mirror in a second so that we can actually have a look along all of the surfaces of the teeth so that we can make sure if there's pockets of food, there's disease to any of the teeth, we can actually have a good look at that. Goes with the sedation as well. So I always just start these off with a cursory exam. I peel back their lips, have a look inside, having a look at the entire distance of the canal, looking at the teeth, looking at the tongue, looking at the whole oral cavity. And you can see we've still got a little bit of food packed up on that side. Over there, you can see that there. So what we're going to do is we're just going to drop his mouth again, his head again, sorry. I might use my syringe to get up around those teeth. A bit of food coming out there. This is where everyone's treats, the carrot they've used to catch their horse comes out too, so we can see that. But we're in now. We've got a nice clean mouth, we've got a nice strong light. Now we grab our mirror. Awesome. So now we're in. We're not really expecting to find too much in a young horse like this, but there are still very many conditions that you will find, including eruption. But this horse has been done fairly regularly. So what we want to do is run our mirror down the entire mouth, make sure that we're having a look at both the outside or the buccal side of the tooth, and then we have a look at the inside of the tooth or the palatal side of the tooth, and making sure that we can see if there's any sort of disease or pockets going along. And then we have a look at the actual flat surface or the grinding surface of the tooth. Now we've got to do that in all 4 arcades, and that takes time. This fella's not quite as sedated as we'd like. He's a bit head reactive. He's good, but we'll give him a little top up so that we can have a look at our mirror, and we want to look at all 4 arcades. We also want to look at the canines and the underside of the tongue, the oral cavity. We're looking for ulcers, we're looking for diseased teeth, anything like that. So what we'll do is we'll give him a little top up and we'll come back once we've had a look inside the mouth. Right, so we've had a good look, we've had a look down each of his arcades with our mirror. We've checked all of this horse's mouth. There's nothing to report inside here. And this video isn't really to show you about dental diseases, to show you the full process so that we can make sure that we don't miss anything. So we've had a good look. He's due for a float. That's about it. There's no major dental disease to note. And we've used our mirror. So now what we'll do is we'll do the float, and you guys can have a look at how we do that. And then we'll show you a post-operative of the sharp points that we've taken off, which is part of a routine exam. Unlike dogs, cats, humans, horses' teeth continue to erupt over their lifetime. So that's why they need regular dentals to curb the sharp points that start to develop. So we can probably do another video on the reasons why we start to develop sharp points in more consistent places, especially in domesticated species. But for now, all we're going to do is just show you the process of floating up the teeth and what we're doing. And that's in comparison to, say, a dog or a cat or a human, where their teeth, once they're erupted, they're in place, that's it. These guys continue to erupt and they'll continue to have dental disease. I did forget to mention too, as part of an oral exam, you actually want to feel, because as well as you look, you also have a good feel to feel those sharp points on your hands. So he's a little bit sharp, he's not too bad, and we'll float him up now and we'll be right as rain. Post-procedurally, you can see what we've done is we've taken the sharp points off from the outsides, and we've also taken them off from the insides of the bottom. And that's going to provide us with that relief and take off all those sharp points as they continue to grow on the outside of the tooth. I'll also show you, while we're here, the tools that we use. So this here is what we call a chamfer burr on a power float, and that'll be able to cut on the side of the tooth at a 45 degree. Provides a nice soft tissue surface there, so that when we're putting that up against the outside of the gum, that'll take off that edge. Then I use what I call the flat disc. Same thing, but that just rounds and smooths that edge for us. So we use those in order to get that. You'll also notice that when we're using these tools, we're regularly putting them in the water again and cleaning them up. That also acts as two functions. Keeps the enamel out of our tool as it starts to wear on it, but it also helps keep the tool cool. A lot of people say you can't do good dentistry with a power float because you kill the tooth and all this. That's all just rubbish, because what it gives us the ability to do is do a horse like that in that amount of time. The floating isn't the key. Very many people can use rasps and do a very good job with their floating, but it's looking and actually having a good feel and getting those tools right the way to the back so you don't miss sharp points at the back, which you can't achieve in a non-sedated horse. So the modern technology, which has been around for a while now, allows us to do more horses more efficiently and safer on ourselves and safer on the horses. But it does mean that we have to have them sedated. So that's why we use sedation as well. Provides that ability to do a good, thorough job and get those tools right at the back where we often miss points. You know, we regularly see going out where a horse has recently been floated, still has the same problems, and it's because the backs haven't been achieved. You can't get right the way back there if you're not looking from back here and you're only getting the front first three premolars. You often miss the back molars. So these tools give us that ability. They also give us the ability to look after many more horses in a day, economically on us and ergonomically on us, as well as on these guys. So there you go, guys. We've had a full thorough dental exam. We always have Nurse Lucy on side. She looks after these guys very well in the crush. So we maintain their stability inside the crush. We look after them and then we monitor them as they come out of the crush as well.